Hello, I'm Dr. Tony Swallow, and I'd like to talk to you today about gum recession, exactly what that means, and what causes it, and then what can you do about it. Gum recession essentially occurs when the gums around your teeth shrink back and the roots are exposed. And usually you start to notice it when the teeth get a little sensitive, usually to cold first, or you start to notice a little bit of the root, or every time you brush your teeth or you drink something really cold like iced tea with a lot of ice in it, you start to get that little short pain right around the gum tissue around your teeth. Well, how does this occur? It occurs for one or two reasons. It's either an infection or it's too much stress. Now by stress, I don't mean mental stress. I mean you're just putting too much pressure on the teeth. Usually because either you're clenching or you're grinding your teeth. Now clenching is when you put your teeth together and you just squeeze. And you keep squeezing and keep squeezing. And what will happen is the bone will shrink down a little bit around your teeth. And because the gum's attached to the bone comes down with it, and then so does the gums. Clenching is a major cause of gum recession. Another problem is grinding. Grinding is when you put your teeth together, but then you keep rubbing on them. Usually you have very, very flat teeth. That doesn't cause as much recession, but it can also cause it. Now, when I said infection, what I'm referring to is periodontal disease. Periodontal disease will start off as just inflamed gums or gingivitis. That's where the plaque and bacteria that's growing around the roots of your teeth, they tend to invade the tissue, they get inside of it, and your tissue will get really red, really inflamed, it'll swell, you may have some bad breath, and then eventually that infection gets into the bone, and then the bone begins to shrink down. When that bone shrinks, the tissue comes down with it, and that can cause recession. Both of these need to be treated, okay, but they are treated different ways. If you have periodontal disease, okay, and usually when you have periodontal disease, something else is going along with it. Usually diabetes, something that's affecting your immune system. So usually you don't have to treat just one disease, you kind of got to treat both of them. But that is something that we could help you with here. To treat the infection, you get with my hygienist and she does some cleanings where she goes underneath the gum tissue. She does it very, very comfortably, removes all that debris, and the gums will tend to heal up. If it's due to too much stress on the teeth, then we need to help you with the clenching and the grinding, and that can have a lot of different ways of going at it. One way is just to make you a little tiny small mouth guard that just goes right on the front of the teeth, or we may need to go in and change some of your dental work. Sometimes it's older crowns and fillings that are wearing out, so your bite is changing. You're not hitting nice and even like you used to. Imagine if one of the tires on your car wears out, but the other three are brand new. The car would wobble when it goes down the road. Well, that's basically what your teeth are doing when you're trying to chew if some of your teeth are worn out a little bit. So sometime all we have to do is go in and change a little bit of your dental work, maybe get you on some kind of a night guard, and usually that's either going to stop the grinding so the gum tissue can come back, or at least it won't get any worse.